Every 8 minutes, a young child in America experiences a medication mistake, and according to a new study, that's not the fault of doctors and hospitals, rather it's their parents. The study says on average, 63,000 children under the age of 6 experience an error in the proper amount of medication that they're given. About 80% of the errors involved liquid medications made when parents mismeasure the proper dosage. For more on the story, we turn to the KCBS Ring Central Newsline and talk with Dr. Patrick Fleming, Director of Pharmacy Services at UCSF Benioff Children's Hospital in Oakland. Thanks a lot for talking to us this morning. I would imagine this starts with the spoons. I mean, if you're using a coffee spoon, a little teaspoon, maybe that's not so accurate.
Yeah, that's correct. There is quite a variability in just the kitchen utensils and everyday utensils that people have in their kitchens and in their houses. So it's really important that you get a device that can accurately measure the medicine you're giving.
They give you those with the medicine if you ask, right?
They do. Most of the time the pharmacies will provide those with the medications that they are dispensing. It's important to note that sometimes these oral syringes will have multiple markings on them. So they may have teaspoons on one part and mLs on the other part, or cc's. So it's important when measuring that you know what side of that oral syringe you're measuring from.
The metric side seems to be more accurate. Why don't we use that?
It is generally more accurate, and there is a push from manufacturers and suppliers of medical oral syringes to move towards more of the metric side of things. So that is a trend that's currently being done, that they're measuring and prescribing more in mLs as opposed to, or the metric as opposed to teaspoons. So
are we seeing bad results? I mean, are kids getting really sick from this?
Yes, particularly if you are using just an average teaspoon from your kitchen, because there can be quite a variance from 8 to 12% variance in those devices. And it may not seem a lot, but if you take that every 4 hours or every 6 hours, or how often that medication is being prescribed or has been recommended, it can amount to more medication or less medication than was expected.
And if it's more, what happens?
Well, depending on the medication, it can be quite serious. If, say, acetaminophen or Tylenol, particularly in young children below the age of 1 year of age, they can develop toxicities from the overdose of Tylenol. In addition, a lot of the combination cough and cold products that they have will often have some other Tylenol or acetaminophen in them as well. And so unwittingly, the parent may give some cough and cold medication to further symptoms of congestion, and they also may give some additional Tylenol for the fever. And what has effectively been done, you've overdosed your child on the acetaminophen portion of that medication.
Are there a lot of ER visits for this?
I think there are a fair amount of ER visits. I don't have that number off the top of my head, but we do see overdoses from children's Tylenol.
Are the instructions always crystal clear?
No, they're not, and plus it's sometimes very difficult to read the small printing on some of those over-the-counter products, and sometimes medications will come in different formulations or different tablet strengths, and so it's often easy to confuse or forget what strength that or formulation that patient was on before they had taken it in a previous time.
Yeah, and especially on the over-the-counter stuff, that print is teeny tiny, and then searching through all the stuff that they've written on there for the actual directions.
Right, and looking at the active ingredient is also important because, as I mentioned, many of these products do have acetaminophen or Tylenol in there. So it's very important to talk to your doctor or pharmacist when picking up one of these products from your grocery store or your pharmacy.
Thanks very much for the time. We appreciate it. That's Dr. Patrick Fleming, Director of Pharmacy Services at UCSF Benioff Children's Hospital in Oakland.